Welcome to the 19th episode of Censored Science, a community engagement project brought to you by Pusat Perubatan Naluri and carried live via satellite by Astro Awani. So as it's been every Sunday for the past few months, we're with two of the most prolific women leading the fight against COVID-19. Tan Sri Dr. Jamila Mahmud, advisor to the Prime Minister on Public Health and Infectious Disease Specialist, Professor Datuk Dr. Adiba Kamrul Zaman of University Malaya. So as Malaysia ramps up its vaccination game in the hopes of opening up safely, there has also been much concern about the number of children and adolescents who have been infected with COVID-19. During the larger part of the pandemic, it was believed that kids' immune systems seemed better equipped to eliminate SARS-CoV-2 than the adult system. Even now, doctors say that even when they're infected with SARS-CoV-2, children are more likely to experience mild or asymptomatic illness. However, this does not mean that safety precautions can or should be dialed down for children and adolescents, and we'll be discussing why on the show today. So as usual, you have our usual suspects. Dr. Jamila will join us shortly, but perhaps Adiba, you'd like to say a few words?
Thank you, Karen. And hi, everyone, and hi, Dr. Chin, thank you for joining us. You know, we've been neglecting the children and adolescents in our conversations for nearly, how many months is it, Karen? Since
it's been 4.5 months.
4.5 months, yeah. And although we did have a session on
the psychosocial
aspects of children, but not specifically on the clinical effects that COVID-19 has on children, and also issues around to vaccinate or not to vaccinate, and of course the impact of school closures. So we thought we must dedicate a session to children, and no other better expert to talk through these issues with us is Dr. Chin, who has huge experience managing children and their families at Sungai Buloh Hospital.
Absolutely. You know, I think one of the hardest parts of this pandemic has been the psychosocial toll it has had on children and adolescents. You know, however, because children are deemed among the most vulnerable of any populace, all policies which were made for the health of our nation were made to ensure that children will be protected to the best of our abilities. And of course, as new data is gathered and shared, rules and policies have been adjusted. And this is why I thought it was very important that the team dedicate a show, especially to the issue of children and adolescents and COVID-19. Hello, Tan Sri Dr. Jamila Mahmud, fresh from vaccination duty.
Still at the vaccination duty. So if you hear the ding dong, is because they're calling patients vaccinated.
All right. Want to start us off, Dr. Jim?
Well, sorry, I'm a little bit late, but welcome and thank you, everyone. It's lovely to see you, Dr. Chin, and Adiba, of course. So what an important topic we're discussing today, and that's children. You know, I've been receiving numerous messages from parents asking me when can their child be vaccinated, you know, what are the risks for children and so forth. So I think this discussion today is going to be really, really important. Just to say that, you know, we are vaccinating quite a lot of young people now. We are entering phase 3, but more importantly, there are a lot of young people who are going to travel overseas to study. So they have quite a critical window now to get vaccinated before they go overseas. And they must be 18 years old this year. Only for those going overseas. For those who are not going overseas, wait for your 18th birthday. And for those who are listening who may have children or friends who have children who want to get vaccinated because they're traveling to study abroad, please don't worry. As long as you email permohonan@vaccinecovid.gov.my, then you will be attended to almost immediately. So back to you, Karen.
All right. So with us today on the show is Dr. Chin Xiao Yuan, a pediatrician attached to Sungai Buloh Hospital. She's been with Sungai Buloh since the onset of the pandemic. We find nobody better to be in on the session today as we discuss children, adolescents, and COVID. So welcome to Sense with Science, Dr. Chin. Can you tell us a little bit about yourself and your work at Sungai Buloh Hospital, please?
Thank you, Karen. Thank you, Sense with Science, for this inviting me for this evening talk. Good evening, everyone. I'm Dr. Chin from Hospital Sungai Buloh. Yeah, I think for the past 1.5 years, we have come quite a long way in treating children with COVID-19, starting from the very first family that came from Wuhan, who landed up in Malaysia, admitted to Hospital Sungai Buloh during that time. So I'm very thankful that we are given this opportunity today to discuss regarding this topic, children and COVID. So even though until today, we would say that pediatric population takes up less than 10% of the general population who are infected with COVID-19 infection, but yet saying so, I think we should not overlook or ignore this vulnerable group. Instead, we should pay more attention to them. As we all know, children, adolescents, they are our future. Yeah.
So is there a reason children should be preferably treated by pediatricians instead of general practitioners before we start the show, Dr. Chin?
All right, I would say that that is more towards a teamwork between the public health doctor, the general practitioner, all those family medicine specialists at the health side as compared to the pediatric team in the hospital. I would say that all the doctors in Malaysia, they are well equipped with common knowledge in treating children. But yet, when it comes to certain childhood-related disease, example, like those congenital diseases, I believe the pediatric team in the hospital will be more comfortable in seeing and treating them, and also managing them while they turn ill. And also, as we know, children come in various sizes, ranging from those less than 1 kilogram in the neonate all the way up to adult size. So when all these children turn ill, I believe a specific pediatric team will be needed to manage them, from giving medication, IV drip, all the way to treating all those critically ill in the intensive care. Yet we are always thankful to have all the general practitioner and also public health doctor out there to help us to follow up, vaccinate our children, and also to treat all the common diseases.
And at what age children be making the transition from a pediatrician to a general practitioner or a family medicine practitioner?
Well, I wouldn't say that there is a specific age. Instead, I would say that it's more towards the type of disease. As we know, if it is more childhood specific disease that falls under certain subspecialty, and of course the pediatric team in the hospital will prefer to follow up that. But yet saying so, some common disease, example as in bronchial asthma, those neonatal jaundice and all, are very well followed up and treated by the public health doctor out there. Yeah, so it all is about the teamwork in this whole healthcare system.
So the United Nations has defined adolescence as the period between 10 to 19 years of age. What medical practitioner is best suited to treat an adolescent and why?
Well, in overseas country, actually pediatricians tend to follow up and treat the adolescents all the way up to 18 and 19 years old. But in our local setting, I would say that it is more towards a joint cooperation between the pediatrician and also the adult physician. But of course, in certain subspecialty, example, as in the pediatric oncology, neurology, or the nephrology, sometimes they tend to follow up their patients all the way up to adulthood. Or some of them, they have a transitional clinic whereby both pediatric and also the adult physician team will sit in together to bring their patients from children all the way up to adult. Yeah. Instead, in pediatric, we have a subspecialty of adolescents medicine specialists looking particularly into this specific adolescents issue and also the disease. Yeah.
Well, that's something that I didn't know. So point one in your favor, Dr. Chin, thank you for that. So now that's out of the way, can you help our viewers understand the sometimes confusing information they get on children and COVID. You know, scientists from University College London, the universities of York, Bristol, and Liverpool, whose studies in COVID in children are about the most comprehensive in the world, have said that the overall risk of children becoming severely ill or dying from COVID is extremely low. To date, in England, only 251 children were admitted into ICU during the March 2020 to February 2021 period of pandemic, and only 25 children and adolescents died as a direct result of COVID-19. And yet, in neighboring Indonesia, with its death toll now more than 60,000, there are growing concerns about the effect of the disease on babies and children. So the Indonesian Pediatric Society says that cases of COVID-19 in children aged 0 to 18 years has risen to 12.6%, or 1 in every 8 persons infected as of 28 June. So, and to date, more than 600 children across Indonesia have died of COVID-19. Can you help us make sense of information like this? Why do some industrialized nations say children are at lower risk of contracting COVID, while in Southeast Asia, there are so many more children dying of the disease?
All right, thank you, Karen. So before I go into comparison between the other overseas and also what happened in Southeast Asia, I'd like to bring your attention to what happened here in Malaysia. So instead, what you say is true. Children are actually less symptomatic or less severe as compared to the adult population. There are various theories behind it. But yet, I would say that what I have seen in Sungai Buloh recently is something that is really worrying. Example, as in last year itself, the whole of last year, from the start of the pandemic until end of last year, children who has admitted because of COVID-19 infection, those less than 12 years, so it takes out about 1,500 children. But for this year, until today itself, is already about 3,600 children that was hospitalized in Hospital Sungai Buloh for treating for COVID-19 infection. So I believe the progress of this disease hugely because of the strain of the viruses, which is getting more and more virulent, as same as what is happening in the adult population. So so back to your question, as compared to the industrialized nation, why is the country over here are not doing that great? Well, I would say the enrollment of vaccination is the key of this reason, you know, because as we know, those countries, they started the vaccination program way earlier. Instead, now they are covering the population of the adolescents over there and all, as compared to here. But I believe one day, somehow or rather, with this vaccination program and all, we will work through that. The other thing also would say that it is accessibility towards our healthcare system. Actually, we are quite thankful that in Malaysia, accessibility towards our healthcare system are pretty good, I would say, you know, thanks to all our public clinic out there. Exception will be given for those in a rural area, in Sabah, Sarawak, and all those, yeah. But we are fortunate enough that, you know, parents don't need to pay a huge amount of money to get their children hospitalized when they are ill and all. Yeah. So, and besides having the healthcare system in place, the awareness of the public also is very important, as in, you know, parents have to be educated and know when to bring their child to medical attention when the child falls sick, and how to prevent their children from getting the disease. So all these factors actually contributes and explain the situation of what you mentioned. Yeah.
All right. Prof, you had a question.
Yeah, I was intrigued by what Dr. Chin said in terms of, you know, the increase in the number of young children being admitted by many thousand-folds. So I just wanted to get a feel for, because at UMMC, we don't admit that many children. We do, but not that many. And I just wanted to have a feel of, are they symptomatic, asymptomatic, or because you also said that, you know, you're concerned about the disease becoming, the virus becoming more virulent and disease becoming more severe, or are they mostly admitted, or, you know, because the parents are infected and there's nowhere to isolate them, so you're bringing everybody in as a family?
All right, Prof. So definitely we see a huge difference in the progress of the disease in these children last year as compared to what happened this year. Last year, the children mainly they are admitted mainly because, like what Prof said, because the parents are ill, no other caretaker at home, they have to be admitted, and generally they are asymptomatic or they just have a very mild symptoms. But this year, what worrying is my whole ward are full of children that needed oxygen support. Some of them are even in the intensive care, and at points whereby the ward in Sungai Buloh can't hold these children anymore, that we have to expand the services of treating all these COVID-19 children in the other hospital all over the states. So yes, definitely they are getting more ill.
Dr. Chin, would you have any other data on COVID infections and deaths in children and adolescents in Malaysia?
All right. I would, if you look into the KKM website, okay, so there is a data on till date, till last month, June 2021. Nationwide, we have roughly about 82,000 cases of positive COVID children that is less than 18 years old. Yeah, so among all these 82,000 cases, actually 33%, which is about 27,000, those 13 to 17 years old, and another 31% are those school-going, 7 to 12 years old, and our young toddler less than 4 years old take out about 24%. And among these 82,000 cases, till June last month, total, it takes out about 15 deaths among all. Yeah, so 9 of them are actually more than 7 years old, and half of them do succumb because of comorbidities as well, example as in cancer-related or immunosuppressed disease, cardiac disease, and also lung-related asthma. Yeah. Professor
Adiba, you mentioned that you don't see very many children, adolescent warding in PPUM, but in your practice and in your hospital, how many have you got at present time? Would you have an idea?
At the present time, I think we probably don't have any more than 20. I don't have the exact figure because yeah, I think most of them go to Sungai Buloh. Yeah.
All right, I see. And Dr. Chin, at present in your wards right now, how many children and adolescents are there in Sungai Buloh?
Generally per day will be ranging somewhere about 150 to 200 patients at one time in a day, ranging all the way from neonates that was born because the mother is positive COVID, all the way up to the teenagers. Yeah.
When you say 150 a day, are you talking about 150 new admissions or 150 in the ward?
In the ward. In the ward. Yeah.
All right. Okay. Yeah. Got you. Dr. Jamila, are children and adolescents being tested for COVID in Malaysia as a matter of course, like what Indonesia has been doing?
I think our testing at the moment, because our numbers are so high, a lot of it is really, you know, the children are probably close contacts to adults who are, you know, positive, or they come to the doctors with symptoms that look like COVID-19. There hasn't been a systematic approach to actually testing all children. You know, we have seen when the schools were open for a little while, there were small outbreaks, and then, you know, the children had to be tested, right? The whole class and all that. But I think if you're talking about the Greater Klang Valley, so to speak, KL, Selangor, Negeri Sembilan, and all that, the incidence is just quite high right now. So I think most of the time we will presume that if they have symptoms, they will be positive. But it's very alarming to hear I'm actually quite shocked. That's 150 to 200 a day coming into.
Not a day, right? The total number of
number of patients at one
at any one time. But what is really worrying is the I mean, we need to look at the percentage in terms of those with severe illness, because I'm sure you saw, Dr. Chin, a couple of days ago, there was a study from the UK, one of the largest cohort studies that showed, children in the UK, at least from the first wave of the infection in the UK, there were very few that had severe disease and death. So yeah, maybe some, we unfortunately, we still don't have a good feel of what variant we're dealing with here in Malaysia, but it is definitely something that we need to look into, yeah, if the pattern here reflects more severe disease in children, because it has all sorts of implications in terms of opening up schools, in terms of how do we prioritize vaccines, and all of that.
Yeah. Absolutely. So let's go through this process. Should a close family member be tested positive for COVID, the family members, including children, will all need to take a COVID test, correct? So now what happens if the child is found to be COVID positive? Dr. Chin?
Okay. Yeah, sorry, Karen. So what happened if the child was found to be COVID positive? Yes, so usually those in our system, they will be contacted by the public health side. Okay, so we have a very well-established COVID-19 assessment center all over nationwide that is assessing all these children. So basically for now, the children who are asymptomatic and all will be allowed to be home quarantined, provided their home environment are suitable. And at the same time, they will be under follow-up under all these CAC center. Yeah. So if the children do have mild symptoms and all, advice will be given for the parents how to look out for and all. And if they do turn ill, there is a contact number for them to contact the CAC center, the doctors over there. And of course, in an emergency, and all parents can always bring it to the emergency department, any hospital, despite private or government hospital, for immediate medical attention.
All right, so let's look a little bit further into treatment and care for children who have contracted COVID. First of all, should they not have been tested, but they are feeling unwell? What are the signs of COVID infection in a child? I believe there is quite a different presentation of the illness in children as opposed to in adults, right, Dr. Chin?
Yes, it is. But yet saying so, the commonness is still the common. Adult and children, both the commonest presentation will be fever and also respiratory symptoms. So fever in children, they are quite typically occurs within the first 5 days of the illnesses. Of course, some of them, they have prolonged illness, prolonged fever, or some, the fever may come later on. Yeah. Respiratory symptoms wise for children will be cough, runny nose, sore throat, and the bigger one, they can tell us they have loss of sense of taste and smell, just like the adult. Yeah, but something in particular in children will be, especially those young toddlers and also infants, they tend to present with a lot of gastrointestinal symptoms, yeah, in particular diarrhea. Some of them may have vomiting as well, yeah. And some of them, maybe that is the one and the only symptoms they present when they have COVID-19 infection. So for children, as any other virus infection, when they have fever, we see a lot of them, especially those less than 6 years old, they tend to present with febrile seizures, right? And also the respiratory symptoms. Recently, we have actually seen more and more children actually came to us presented with viral croup. Which also, which means that it is inflammation around the vocal cord region. They presented with hoarseness of voice, noisy breathing on inspiration. Some of them even needed oxygen or ventilator support because of that. The more rare symptoms will be rashes and conjunctivitis. We do see certain cases in children as well. Yeah. So, but as we said from the very beginning, generally they have mild symptoms. And some of those children who have mild symptoms are allowed to be home quarantined at home. So things that parents can do to help all these children with all these symptoms is no difference from any other infection. Okay, so one thing that is important is to make sure that the children do hydrate themselves enough. As we all know, when the child falls sick, one thing is very difficult for them to take in any feeds. So parents should encourage them. A small but frequent feeds will help. Any various beverages that they prefer. All right, and when they do have fever, just like any other illnesses, tepid sponging, paracetamol, all these will help. And for parents also, it's very important for them to learn how to recognize when the child needed immediate medical attention, which I think we'll come on that later on. Yep.
Okay, Dr. Shin, one thing that struck me, you talked about conjunctivitis in a child with COVID, right? Would the conjunctivitis also present with fever and respiratory breathing problems, or would a conjunctivitis attack sometimes signal that the child is COVID positive?
Generally, they presented together with other common symptoms. Yeah, but not that many. We do see a few cases, but not that many. Yes.
All right. But generally, also, if the child is presenting with conjunctivitis and COVID, they would probably be sicker than they would be with just a case of pink eye, right?
Yeah. Yes, yes.
Okay. So when it comes to fluid intakes for children who are suffering from COVID, is there a prescribed amount of fluid that a child should be drinking in order to keep hydrated technically?
Yes, of course. If you come to the pediatric doctors who are exceptionally OCDs and all, we count everything by body weight, but I'm not going to stress the public with going into taking out their calculator and counting their child taking how much fluid per day. But generally, I would advise that, anything that if your child taken less than half of what he or her usually take, then is something that you should be concerned about.
All right. So if a child is not being able to hydrate themselves, or the parent cannot help the child hydrate, would this be would this be grounds for a call to your doctors and to say that he or she is not drinking and I'm worried?
Definitely, yeah. That means that the child at least need a help in terms of intravenous drip, while helping the child to tie through this period when the child at the recovery time is.
All right. And how soon do you think parents should alert the hospital or their doctors when the child has not been having enough fluids? I mean, for babies, we look at, how many times the nappies or the diapers are wet. What about a slightly older child who is able to go to the toilet by themselves? What should we be looking at?
All right. Of course, when there are reduced in terms of the urine output, it actually shows that it's significantly that the child is dehydrated. Yeah. So in terms of that, I would say that as soon as possible, medical attention should be, the child should be brought to either clinic or the hospital as soon as possible during that time, because it can happen, many things can happen when a child gets dehydrated. The circulation system may get collapsed and all, especially those young ones, infants less than 1 year old. Yeah.
Okay, so this is open to all the specialists on the panel. Is there any data which can tell how many children with COVID have recovered successfully at home without the need of more serious medical intervention?
Okay, Karen. Generally, I would say that the children, those that in our hospital, they do recover well. This is one thing at the positive side. But yet saying so, as I said that we have seen more and more children that are getting more sick, that need oxygen support, intensive care, which these children, this group of condition actually happens for the past few months only. So this group of children are still under our long-term follow-up surveillance in our clinics and all. So we would need more data and further follow-up in terms to say that, you know, do they end up more long-term complication and all. Yeah. But the other thing that what happened that we have seen several cases in our hospital would be something that is actually quite worrying. We call it as a multi-system inflammatory syndrome in children, in short, MISC. This syndrome, typically it occurs about 2 to 3 weeks after the first diagnosis. So some children, they may be initially at the initial time of the diagnosis, they were asymptomatic or mild symptoms, and they are discharged well after 10, 14 days. But later on, they came back 1 or 2 weeks later with severe symptoms that needed medical attention, and some even admitted to the intensive care. So what are the symptoms in general about this MISC? Will be include persistent or prolonged fever, and they have rash all over their body. They have swollen digits, fingers and toes. They have conjunctivitis, they have red lips and also the tongue. So these are something, and generally these children, if they do have this MISC, they are quite ill, lethargic, ill, irritable for the young ones. So these particular complication of COVID in children needed to be treated immediately. Otherwise, it can actually end up with quite a bad morbidity. Yeah.
All right. So when does a parent know when their child needs more drastic medical attention? What are the signs that a child is becoming sicker? And then what do the parents do?
All right. So this one is a recognition of a sick child is generally almost the same as any other infection. So as we know, COVID, it affects the respiratory system. Yeah, that's the most common one. So in children, same also as adult, one thing that needed immediate emergency treatment will include the shortness of breath. So in children, they tend to, when we say about shortness of breath, means they have breathing faster than usual, and they have this recession between their rib bones. And some of them may be presented with noisy breathing like wheezing, or stridor, noisy breathing on inspiration. So besides respiratory symptoms, as we said just now, the other thing that is more important will be the hydration of the child also. So if anytime the child has a reduced oral intake, as I said, less than half of his or her usual self, and also there's increasing more GI losses, the diarrhea is persistent, getting more, okay, the child looks very lethargic, the diapers are dry, the child do not urinate enough, not active, their tongues, their lips looks dry, that means that that child needed medical help to hydrate the child. All right. So, and the other thing also, if the child do presented with persistent fever, right? So as I said just now, generally they do have the fever at the first 5 days of the illnesses, but sometimes in certain condition, the fever go longer than that, prolonged fever, persistent fever. So those things also should, the parents should seek medical help during that time, because sometimes besides COVID-19, we do have co-infection with other viruses and other bacteria that needed some other treatment to help the child.
Absolutely right. And do all private hospitals accept children in this need, in this distress? Or do you have to go to a specific COVID hospital, Dr. Chin?
Definitely. So if in this kind of emergency condition, the child is ill and all, if you do have a contact with the COVID assessment center doctors over there, CAC, you can always give them a call and they will give you a further instruction of what to do. But of course, when it comes to emergency condition, like your child is having shortness of breath, or even the child who has a febrile seizures at home, that child need to be brought to the emergency department of any hospital, being private or government hospital, any hospital in this Malaysia. I think for now they are well equipped in treating this patient.
All right, so COVID or no COVID, any private hospital should not be rejecting a patient who presents in such severe distress.
No, yes. Yeah, so they will stabilize the patient, but after that, where will the patient be hospitalized and all, that will depends on the per state arrangement and all.
Understood. All right, and Professor Adipa, may I ask if at PPUM there are separate spaces for children in the COVID ward at PPUM and other hospitals? And also Dr. Chin, in Sungai Buloh, how do parents care for the children when they're in the COVID ward?
The quick answer to that is yes, we do. And, you know, that because we have to bring in parents to care for the children, so, you know, we have to set aside some spaces for families, etc., etc. So I think it's pretty similar to what Sungai Buloh, obviously not as large as that in Sungai Buloh. Yeah.
You know, one of the scariest things about COVID is how people say, once when you're an adult and you have COVID and you're in the hospital, you are alone. No visitors, no family, no one, right? When we talk about children and who are COVID patients, Dr. Chen, how do you deal with them? How do you treat them in Sungai Buloh Hospital and hospitals around Malaysia?
All right. I think as compared to the overseas, certain countries, they actually isolate the children with their parents. So that means the children will be by themselves in the pediatric ward. But locally in Malaysia, we are not doing that, mainly also because of the psychosocial attachment that the children needed from their caregivers. So we do allow caregivers to be in to take care of the children, although we do try our best selectively to get those caregivers who is or has been infected with COVID-19 in order to, you know, instead of bringing in a caregiver who is negative and exposed further in the ward. Yeah, but we do understand sometimes in certain circumstances we can't avoid that. The child is the one and the only one that is positive in the family. The other adults are negative, and also those families, we will try to isolate them in the isolation room. We will advise the caregivers in terms of hygiene. Sometimes even they put on a barrier clothing while they need to take care of all these children, wearing masks all the time. Yes. So that is what happened right now.
All right. So speaking to all the doctors on the panel again, in your professional experiences, do children warded for COVID generally recover? And following on to that is a question by Sharianne Quirk, who asks about cases and studies of long COVID in children who have had COVID in Malaysia. So what are their prognosis for recovery and the long-term recovery plans?
Yeah, so I think last week, Dr. Yasmin do talk about long COVID, yeah, but that one generally in the adult population. So in children, so far, one of the solid data that we get is in the UK Office of National Statistics, estimated about 12 to 13% of children aged between 2 to 11 years old have persistent symptoms 5 weeks, up to 5 weeks after the first diagnosis. But yet a lot of data all over the other countries are still very scarce, especially locally. we are still yet on following up our children, and also we are still yet collecting all this data. Yeah, but the reports reported as those children who presented with all these persistent symptoms are more like what Dr. Yasmin discussed last week: fatigue, nausea, some of persistent cough or persistent loss of taste and loss of smell. And also the other aspect will be the psychosocial impact on all these children who are affected by COVID-19 infection.
So long COVID is a very real possibility for children who have contracted COVID.
Yes.
It is.
Yes.
Right.
Yeah.
All right. So are there any new or additional health precautions parents can or should be taking to ensure their children remain safe from COVID? This is besides the usual norms of staying home, scrupulous hygiene, and social distancing. Is there anything new?
All right, I would say that vaccination is the key. Yeah, so we all know that currently, although the overseas, they are vaccinating all the adolescents and all, but not yet on the children less than 12 years old. So in order to protect this vulnerable group, the best thing to do is to vaccinate those adults that are keen around them to protect them. Yeah, so I think besides that, strict SOP, like you say, hygiene and all those still have to be in place despite the vaccination has been rolling on in our country. Yeah. So, and the other thing that I would like to advise to the parents and also the teachers at school is, don't just ask the children to follow the SOP blindly and all. Do explain and educate them properly on why we need to do so. That is very, very important because we know that this pandemic is not over. Things are still going on long. So we don't know that how long are we going to continue with this SOP, and also we need to make the children understand that why we are doing so and all. Yeah.
That was a great reply to our question about how we keep our children safe in school. I think, Dr. Chin, you're spot on there. It is true. We can't ask or expect children to just parrot the things that the adults tell them. We have to help them understand exactly why they are doing this and why it is crucial for them to not want to sit with their best friend during break or to share food and drink, when it's so usually the case for children. You're spot on there. So are there any we've covered children and COVID infection in general. Is there anything different or new to watch out with COVID infections in adolescents? Is there a higher prevalence of COVID infection in adolescents than in children? And if so, why?
All right. So as I mentioned the statistic earlier on, yes, definitely the prevalence of this COVID-19 infection in the adolescents as compared to the younger age group is actually way higher. Okay. So just like we say, those ranging 13 to 18 years old, it takes out about 1/3 of the amount of the children who was infected with COVID-19 infection. So there are various theory behind it actually. So as we know, children are less severe as compared to adults. There are various theory behind it. Some say that it is because of the different expression of this ACE2 receptor, which is something that is very important for the SARS infection to enter our human body, and it is different in children as compared to the adult. And some do say that in children they have a different microorganism in their respiratory tract that actually protects them from getting severe illnesses from this infection. So and we know that adolescents are the transition from the children to the adult. Yeah, so all these changes as they grow, all these protective mechanism and all do changes as they grow. So hence the way they presented with the disease are more mimic those young adults.
Understood. Thank you, Dr. Shin. There's a question from a viewer, Margaret Wing, who wants to know whether having temporal lobe epilepsy increases the risk if a teen who is 16 years old were to be infected with COVID-19?
No, I wouldn't say so. Yeah, because generally those temporal lobe epilepsy, they are on anti-epileptic and all. It is not a kind of immunosuppressive medication. Yeah, so but yet saying so, these children should be even protected more. So say that when we start to enroll our vaccination program in this group of teenagers, all these with the comorbids is the one that we wanted to prioritize, you know, because say that they do have these epilepsy problems and they do have the COVID-19 infection. It may actually aggravate the underlying illnesses, make the seizures more or even more difficult to control. Yes. So. Yeah.
Dr. Jamila, if you can just follow up on this one. This is the second part to the question. The teen in question is only 16 years old, so not even 18, which is the minimum age now for vaccinations. What would happen in a case like this? Would there be a chance for the young person to be inoculated before the rest of the other people on the list?
Yeah, so I think you're touching on the question of vaccination among young adolescents and young children. You would have seen that NPRA, our National Pharmaceutical Regulatory Body, has already approved Pfizer for the age group 12 to 17. So, so as far as the drug is concerned, the approval process has gone through. At the Jawatan Kuasa Access Vaccine, the JKAJAV, which meets every week and has a scientific committee, they study the data and evidence that is global data and evidence to look at the safety. Can we look at safety and efficacy as well in administration of vaccines? Now, unfortunately, there has been some reports of myocarditis and cardiac complications in some countries that have administered vaccines. And so far that has prompted JKAJAV to say, yes, they're very important. It's an important group to vaccinate. But in light of the fact that we need to also protect the adults around children, let's prioritize the adults first. Because if something is not 100%, well, nothing's 100%, but if it's not significantly safe for a younger person to take, the best protection you give them is actually protect the ones around them first. So as mentioned by Dr. Chin, so that's priority one. What we're also looking at now is other evidence. There is some evidence emerging that a single dose of Pfizer rather than a double dose may actually offer enough protection but have less adverse effects. So we're looking at that. The other thing we're looking at is there's been a trial on the use of Sinovac for young children, and the results are promising, but they've only completed phase 2, so we're waiting for phase 3. So we will like to err on the side of caution and safety. But as mentioned by Dr. Chin and your question as well, there are children that have very severe metabolic disorders. So they may have type 1 diabetes, they may have obesity is another issue. So for these ones, on a case-to-case basis, if they're like 16 years old or 17 years old, we may want to consider, especially if they're in a very high-risk environment, but with very close monitoring of the children who get it. The only, yes, we've seen some pretty horrible adverse effects, but majority of them actually, they recover. So that's quite reassuring, but myocarditis is not something you want to have in a young person. So so the jury is still taking it cautiously, but as you know, in Malaysia we need to prioritize adults, the vulnerable adults, and so forth. So I think that in a couple of weeks we will get much more clarity on the evidence for vaccinating young people.
Thank you, Dr. Jim. To our viewer, Manimala Subramaniam, who asked, does the child also suffer from long COVID symptoms after the patient has been discharged? Yes, Manimala, long COVID is, as described by its name, long-standing, and it is a long illness. So if you are more interested into finding out what long COVID is, our very, very fantastic session last week on long COVID, available on Facebook on this page, is available to you and to other viewers who want to know a little bit more about it. So Dr. Chin and Professor Adiba, does contracting COVID in adolescents have more long-term effects than getting it as a child? And also, would children and adolescents who have gotten COVID be more immune to different strains of it?
I think the Chin, if I may, the issue of adolescents developing long COVID and all that, you know, as we discussed last week, the whole scenario around long COVID is still very much research, and I don't think anyone has any firm answers for some of the questions as to who develops and how long, and you know, all that's a big question mark at the moment in adults as well as in children. Yeah, and whether children are more immune or develop more long-lasting immunity. Chin, do you? You know, I've only been following the adult scientific literature, I must say.
Yeah. But what I would say that this pandemic is not over, that we never know, and we won't know that what is going to happen next with the virus and all. But to be honest, we do actually see cases of reinfection happening among our children, although it's not common, but it do happen. That means children who actually somewhere infected last year, and this year they came back again with the illnesses and they're positive for COVID and all. So I really couldn't answer whether will they be immune towards other strain of the viruses and all. Yeah.
All right, that is fair. You know, we don't put our scientists on the hot seat. You know, we are just asking you to share what you know from your point of view. So I know this is a new disease, and so the playbook is being written as we speak. But can the doctors here share anything concrete as to how science thinks being affected with COVID-19 will impact on the health and developmental growth of children and adolescents in the future?
Right. I think this has been quite a hot topic among all the pediatricians globally and all, looking into the impact of quarantine these children at home during this pandemic time. Definitely it gave a huge impact either physically or mentally on all these children, right? So in terms of physically, you know, they are less active. You know, they don't go outdoor as much. So for those young children who are still growing up, you know, it will hugely affect their gross motor for them to run about, you know, climb in the playground and all, you know. So, but the other aspect that will affect the children a lot are the social development. So especially our children or the school-going age children, you know, they don't get to be with their peers as much, which we all know that, you know, children playing with their peers is very important in their social development. And not only that, you know, more stranger anxiety, separation anxiety with their parents, and all these issues do set in our children at this pandemic time. Yeah, so I would like to also bring a special attention of our minority group of children with special needs. So we all know that all these children, they are very adhere to all those structural routine in their therapy, and also with this lockdown, with this quarantine, everything is interrupted in them. It will actually affect a lot in their behavior problems. As well as causing more stress in the family, and also it is something that is really quite concerned about.
That's absolutely true, Dr. Chin. I think for a person who has never had to deal with a child with behavioral issues, or somebody on a different spectrum. You know, it is bad enough to have to parent a normal neurotypical child, but with a neuroatypical child, the challenges are 20-fold, you know, and as you said, the loss of routine, the loss of schedules, the loss of structure is a huge, huge thing for any parent who is parenting a neuroatypical child, and it is very, very difficult. So we move on now to vaccinations for children. Dr. Jem, the moment the WHO said it was safe to vaccinate children over 12, you were all ready to go out and protect the secondary school kids, at least, in the hopes that it would hasten the opening of schools and keep children safe. But you've listened to the further science and you've pulled back a bit. Talk to us about your view on vaccinating children and adolescents.
Yeah, I think I alluded to that earlier, that in an ideal world, if the drug is deemed to be safe for use, you'd want to administer it quickly. But people have sort of held back a little bit because of some reported incidences of myocarditis and other complications. Because generally children bounce back very quickly and they recover. But the recent Delta variant and other variants have unfortunately shattered our image that children just bounce back, because they actually get quite sick, as Dr. Chin has shared with us. So I think that, as I mentioned, we are still studying it, whether we look at different dosing regimes or we look at other vaccine that might be used. But we need to have clear evidence before we give children the vaccines. The other thing, of course, is to stress again that you also need to vaccinate the people around the children. So it's not just the parents, it's also the teachers, it's also the janitor in the school, the canteen operator, everybody that, you might have access to. And don't forget, let's look back at several episodes ago where we talked about ventilation, that, we need to take all these, I keep repeating the Swiss cheese approach, that there are layers of protection that you need to then put in place, whether it is, the social distancing, the masks, the washing of the hands and all that. And then you have also that layer of, ventilation, vaccination, and so on and so forth. And also good nutrition, is very important for young people, because you need to make sure the immune system is constantly, in good shape. One thing though, I would say is that one of the things about COVID, and please correct me if I'm wrong, Dr. Chin, I'm not a pediatrician, but because we take all these precautions, the incidence of childhood influenza and all this are lower, right? And children need to have some of these infections to build their immune system. And it's possible that, and I think Karen, you alluded to it as well in an article in The Guardian, that maybe they're not building their immunity well enough, so that if they do fall sick with COVID, they actually fall quite sick. So I don't know whether that is something that we are seeing in Malaysia as well. It'd be interesting to know.
So there's not yet a policy set for Malaysia as to what age it is mandatory to vaccinate children and adolescents, right, Dr. Jim?
There's no mandatory vaccination. It's still voluntary, right? Okay. And even for adults. So for children, until we get a little bit more evidence and research, which will be forthcoming, it won't take very long. As I mentioned before, if a child is morbidly obese, has diabetes and so forth, you could make the case to vaccinate the child.
All right. So as a parent, I've already received a circular from my child's school from the Ministry of Education, requesting my child either apply for vaccination on her own MySejahtera or be placed on my MySejahtera as a vaccine dependent. So would you have any insights on this, Dr. Jim? Is this just gathering so that if the rollout happens, people are already in queue?
Yes, I think some people are already registering their young, their children and all that, right? If you're below 18, you obviously need parental consent. But, as I said, while we rapidly accelerate our vaccination of adults first, let's get that straight. We need to get the adults and the vulnerable groups done first. Then only we can move to the next phase.
Teresa Wong, a viewer, wants to know whether there will be any vaccine for children younger than the age of 8?
There are trials ongoing, both Pfizer as well as Sinovac. Sinovac started the trial at the age of 3. Pfizer is also going much lower. So yes, all the drug manufacturers are starting to look at trials for younger children.
So the sentiment on the ground from many of my friends who are parents is this: they are not anti-vaxxers. Many have already received their first dose, some have fully completed their 2. However, they said they would rather wait for more data to become available before vaccinating their children. Dr. Chin, would you concur with this line of thought as a pediatrician?
Well, I would say that, in terms of those rare side effects that we see in the vaccination, we will not see this rare side effect enough if we don't vaccinate enough of a large population, you see. So all these data comes from while the vaccination enrollment started to roll on, then people start to see all these rare side effects coming out and all. So I do agree, yes, it is, some parents are really worried. They wanted to wait for more data from overseas and all. Fair enough. We do understand the concern of all these parents. Yeah, but yes, we will still need to continue to look into all these data and all. And I do really agree with Dr. Chamila regarding we really need to cover a huge population, enough population of the adult who are keen for the vaccination before we talk about vaccinating our adolescents. So after we have covered enough population of this adult with this vaccination, the next come will be all those who are like Dr. Chamila say, those with comorbids and those staying in the high-risk area like the residential area, orphanage house, these hostels and all. Yeah.
If I may add to that, just since we're on the topic of myocarditis and all the AFIs, just to caution everyone out there who are adults, it also applies to adults that when you've had a vaccine, don't go and try to show everyone you're so macho and lift weights and run 10 kilometers. Okay, now you can't do that because of MCO, but you're supposed to take it easy for a week. Don't do strenuous exercises because myocarditis can also happen in adults. So, as with anything you put into your body, everybody will react differently. So you've got to take it easy and let the vaccine settle in a week or so and then start building up your activities.
On that point, Dr. Jim, and when you say excessive exercise, surely yoga and a bit of stretching is not excessive, right? What would you consider excessive exercise for, say, a 30 to 40-year-old person?
Yeah, well, you might have seen in the unfortunate situation of a child, I think a young adolescent in Singapore.
Singapore, the 16-year-old one.
Double his weight, right? And that's hard on your heart. Running fast and so forth. I think stretching, yoga is fine.
All right. So, this is another public service announcement for your favorite vaccinator. Please, no weightlifting. Please don't go off and challenge yourself by trying to do 40 flights of stairs on your condominium as exercise because you can't go out. You are fine to do yoga. You are fine to do your light exercises, but nothing that taxes the heart after vaccination. So let's, Dr. Adiba, Prof. Adiba, perhaps you want to weigh in a little bit on on this issue of vaccinating children. And there are some parties who are really, really wanting vaccination for children of Adika age, vaccination for school-going kids. What do you feel about this?
Sorry, I was distracted. Please repeat.
I caught you, bro.
Yeah. sorry, you did.
I just wanted to know, Prof, your particular feelings about people who are basically baying for vaccinations for children and in the hopes of normalizing the school routine. What are your thoughts about this? You know, particularly as a person who has fought very many long-standing illnesses and diseases in the country.
Yeah, there are pros and cons, right? So on the one hand, I think we've heard, although right from the beginning of this session, Dr. Chin has outlined that the number of children who are getting more sick is increasing. But overall, I think in the scheme of things, the potential to develop severe illness in children is so much less compared to adults. So I think given I know Tan Sri Jamila and YBKJ and the entire vaccine team are working extremely hard to get as much vaccine into Malaysia as possible. But not just because I'm an adult physician, but I think the race to vaccinate adults is I think trumps the need to vaccinate children for the time being. There are many ways that we can still, once we bring the current surge down to a manageable, acceptable level, I think it will still be safe to bring children back to school even without vaccinating. This is certainly the experience from countries who've experienced, huge outbreaks as well. But attention to details like social distancing, masking, opening windows, all that remain. Okay, so and the other thing, at a global level, I think this debate's been quite heated now, because in terms of the risk benefit of vaccinating children versus vaccinating thousands and thousands, if we think beyond the boundaries of Malaysia, there are still millions of people in countries who've not even had one shot with a vaccine, including healthcare workers, So I haven't looked up the most recent vaccine coverage, but in the entire, and Tan Sri Jamila may know this better, but for the entire continent of Africa, I think the vaccine coverage is still less than 5%. There are still many, many people who are at very high risk who have not been vaccinated. Well, some can argue that that's not our problem, that's a global, vaccine equity issue. But I think these are some of the risks, the benefits, the pros and cons that we need to weigh up.
All right. Thank you.
May I add on that, Prof? Also, I think also for those parents who are so eager to get vaccination into their younger children, those less than 12 years old, we have to understand also the other difficulties of establishing this vaccination in this young group of children. As I said just now, children come in various sizes. So just like any other medication, in order to establish and to do research and all on this vaccination, the dosage is also something that people really need to look into it seriously. It is absolutely different dosage, to put in a vaccination into a vaccine into a 6-kilo child as compared to a 60-kilo adult also. So I think that is also something that people, those companies and all, really have to look seriously into it before we put our foot down and say that yes, we can vaccinate our children then all. Yeah.
Very good point. Yeah. See, adult physicians and children and pediatricians think very differently. They always, the attention to detail, doses, all that, it's a little bit more missing, at least me.
No, I think it's just different. It's not missing, but you guys operate on very different zones, but the zones do overlap, which is why we need both the adults and the pediatricians. So, Dr. Jamila.
Let the OBGYN, GYN
adjudicate.
yeah, that's right.
I will start with the OBGYN. I think that's a really important point, because even when you start doing trials for drugs, right, for children, a good trial will have very different dosing regimes. And this is why I was saying earlier that we are looking into some of the trials that have actually done it with one dose, right? To look at what is the response with the first dose, what response you get. And actually it's been very, very promising to show that in young people and children sort of respond to the vaccine in very different ways from adults as well. It's not just about the side effects, but also the positive effects that kids actually do much better than adults. They mount very, very good immune responses. So the only thing we don't know, and that's because it's so new, is how sustained the response is. So for pregnant women who actually get vaccinated, they do pass the antibodies to their babies, right? The newborn babies. So that's a way that you can protect your babies as well.
All right. Dr. Chen, you spoke a little bit about the stressors of being shut in, especially for kids. And we have a viewer who's watching us now. And Irene Yap says that she notices that a lot of children with no social interactions are suffering from suffering from mental stress, with her child being very quick to throw tantrums excessively. And she wants to know if you have anything to help, any advice that you can give parents who are dealing with this.
All right. Yes. That it is not only that particular parents. I myself experienced that my children are the same at home. Yes, they are going through a difficult time. So you have to understand that these children mentally they are anxious. They don't know what is actually happening around them, and also bear in mind, sometimes while you have your discussion of what is happening in this global during your dinner time at the dinner table, please do not ignore that one little ear sitting at the side. They are actually absorbing and getting in what is going about with their minimal knowledge. So we should always address to them and talk to them, explain to them, educate them what is actually going on globally right now, what is going on around us right now, make them understand. Yeah. So besides that, children who have behavioral problems and all, of course, during this difficult time, as much as possible, you will wish that, they get more attention from their parents, one thing. Yeah. The other thing that is possible, parents can actually encourage them in, now we know internet is the only way, is the only window for them to look out of this world, you see. So get them into a small little play group, even through Zoom session like this. It is a way for them to interact. It's a way for them to interact. So now we even have a lot of things that people suggested, like a virtual tour in the zoo organized by various farms and zoos and all those. So all these can actually help them during this difficult time. And the other thing that I would actually advise the parents out there are, before we talk about getting a balanced mental health in these children, we should always emphasize on the physical health of them as well. Children, they have a lot of pent up energy in them. So being locked down, being quarantined at home, those energy has nowhere to go. So even at home also, I would actually advise parents at least 1 hour a day, let the children run around, jump around, scream out loud, laugh out loud, let the energy get out. You will get a better behaved child at the end of the day. I always believe that. Yeah. So other way about it is, I think with this quarantine and all, a good routine will actually help to calm a child down. you see, because there are so many uncertainty, unexpected things happened around us. So do the children as well. So at least a basic strict routine will be something that the child knows what is going on after breakfast. The child will know when it's time they are supposed to go out and play. And the child will know that when is the time mommy will switch off her video conference and come and play with me. So this kind of routine will actually help to calm the child down, and hopefully it do help with those child who has behavioral problems.
Yeah, I have to calm my husband down as well, because he's always on some Zoom call, right, or conference. I think Adiba faces the same problem.
All right. Husbands, recalcitrant husbands aside, who need calming, I think you just throw durian at them, that should be fine. Now, Dr. Jim, the question about the government's policy towards vaccination. If the rate of side effect from vaccination proves to be more than the rate of morbidity in 12 to 17-year-old males, can we morally vaccinate children in this case? I have to say this first to all our viewers. We are not policy makers. The panel here are scientists. Policy is sometimes very, very separate from science, which is a very sad but true reality. So having said that as a caveat, I'll pass you over to Dr. Jim.
Well, I'm going to correct you there on the vaccine policies. It's very much science-based, and I'm very grateful for that. So I do sit on the policy body. So as I mentioned, there is a scientific committee that looks into every bit of detail. So for the vaccines, we have to be super sure that we are dealing with evidence and science. I want to share as well that last week we had a very good meeting where we invited some of the leading pediatric cardiologists from IJN, from Sarawak. I don't know whether you were there, Dr. Chin, because there were so many of them in the call. And really discussing at length and in detail on what our views, sharing, and the conclusion, as I mentioned earlier, was we have to get a little bit more evidence and look at other vaccines that might provide to be safer or even change the dosing. So I think this is very, very, very important. Yeah.
Right, Dr. Chin, this is a question I think I'm just going to shoot to you. There was an article suggesting that when antibodies are forming in our body, our immunity decreases. So when we take the second dose of the vaccine, our immunity decreases even more. And it is only after 14 days after the second dose, our antibodies completely formed in our body and our immunity starts to grow rapidly. Is this true?
Well, I wouldn't say that your immunity in your system is actually low after vaccination. I don't believe that. Yeah, but I don't know, because I didn't really actually come across any of the studies and articles that actually prove these facts of it. Yeah.
Sorry, I threw you to the wolves on that one, Dr. Chen. It was very unfair of me. It's just that a lot of things feel and sound like the truth when we read them on social media and Facebook, and it's very, very important for all of us to note that there are certain things that we have not studied as lay people, and not everybody who's writing an article like this is medically trained. So the only thing I can say is check, recheck, and double check your sources. Make sure that the article is coming from an informed source. Don't be so quick to believe something that you've received on a WhatsApp forward. Always take it to your professionals. The reason your GP is there for you is that he can answer all these questions if you bring it to him as well. Please don't take it as gospel just because it's on social media or it comes on your Facebook feed. So now I am just going to end the show, to wrap up the show with a vaccination update as usual. Dr. Jim, can you bring us up to speed, please?
Yeah, before I do that, I just want to address a question in the chat from, I think, Puan Zarina. I'm really sorry that your 20-year-old son is struggling. So the last time I said, let me help, I had about 150 pregnant women writing to me. So this time I'm going to say, can you write to Sense with Science? Send a message to the Sense with Science message box. Give me all the details there, and my staff will look at it. They are very actively vaccinating young people now going overseas in many parts, many of the vaccine centers. So I don't know why yours was missed out. I will do my best to make sure it's dealt with quickly, because I think, yeah, so drop a message to us at Sense with Science, and one of my team will look into this. So let me start with saying that all of us are probably, I think we have collective anxiety and depression looking at numbers, but let's park numbers aside. Let me give you a little bit of a reality check, but also some hope. We know that there are more and more cases coming in. The Delta variant and other variants are worrying. They're causing more severe disease. So please, it starts with us. We have to take care of our, making sure we take those those public health measures. Look at your ventilation. Please take care of each other. And I have a special appeal to those who are Muslims. Don't even think about Hari Raya Adha. This is not the time. This is not the time. This is a Eid of sacrifice, and the greatest sacrifice you can do for your family and for the nation and humanity is to please stay at home and don't travel anywhere. The second thing is, I'm going to say is that it's been good lately. Our vaccines are now coming as fast as we can anticipate. I can also share with you that since 1st of July to now, we have touched more than 300,000 a day. So we have really increased by about 100,000 since June. And we hope to touch 400,000 a day soon. And that means about just under 1% of the population per day will be vaccinated, and this is so important to ramp up. And just to give you some hope and positivity, I will tell you, I'm looking at my data now, that the percentage of Malaysians who have been vaccinated with 1 dose as of yesterday was 23.4%, and with 2 doses 10.5%. Now obviously in some states they are doing better than others. Some states have even touched 29% 2 doses, and some, the lowest is about 7.6. So we have to help the ones who are a bit slow. So if we can ramp up our vaccinations as quickly as possible, then we have a great chance to reduce the severity of illness, and therefore not overload in our hospitals. Our frontliners are exhausted. They are exhausted physically, mentally, emotionally, and anything we do now, please think of them, put ourselves in their shoes, and the nation has to come together. Adiba and myself have been working very hard this week. I use concealer, so I don't look so tired as Adiba, but if I take out my concealer, I'm as tired as her. Because we all have to put our heads together now and really come as a nation to get all of us out of this safely. We just need to get things a little bit under control while we vaccinate everyone aggressively and as quickly as we can. This is a time that we help each other. This is not a time to look for fault. This is a time we build on each other's strength and the courage and the passion and the compassion that I know each and every one of us is capable of. I'm just so touched looking at what's going on. And it's easy to be angry and frustrated, but it's easier to be kind, I think, and it's much better for your heart to be kind than to be angry. So I appeal to everyone, let's all, let's do our part. Right? And people like Adiba and myself and Dr. Chin, Dr. Chin as a frontline worker, Adiba as a frontline worker, and me trying to push, policies and ideas and, working on the vaccinations as quickly as possible. We will all do our best to help you. So if you have questions or you have, queries and you read things, please don't pass it on until it's verified. This is very, very important, because the last thing we want now is rumor mongering and all that. And also, you know, let's also treat everyone who is sick and who has passed, whether from COVID or suicide or anything, with dignity and respect. That we have to, you know, really, you know, at this very, very, I would say, difficult moment in our lives, in our history of our nation, we have to find the energy to rise above ourselves and be better versions of ourselves. I think this is my big ask and appeal to all of you, and something that I also remind myself every day. So thank you for following us on Sense with Science. Dr. Chin, I am in love with you because I think you explain things so easily. I wish I had a child and I can take my child to you, because I think you're a fantastic pediatrician. You know, thank you for all the hard work that you do, and Adiba as well, and Karen for moderating this. I believe this is our second last episode of Sense with Science, right?
Yes, it is.
Yeah, and then we will be, you know, having repeats. But again, this is our passion project, and we are very happy that there are people who are following us and watching our videos. Thank you very much, Karen.
Yeah, and Dr. Chin, for being so amazing with us on the show, despite the fact that you're on the front line every single day. On behalf of our viewers, thank you for being at Sungai Buloh Hospital for this year of pandemic, doing all you can to care for us and our children. Would you like to say a few words in closing?
Well, first of all, really thank you for this opportunity of inviting me. But I apologize that I just have to wrap this up with a bit of a negative news, as in what is actually happening right now is I'm seeing a lot of children in our wards. What happened is they are all left alone. Not because of any other reason, just because their parents are too ill to take care of them. The parents needed intensive care. They are both intubated, and the children are absolutely left alone without any caretaker. So this is what's happening right now in all the pediatric wards. So with this, I would really like to urge the public to really adhere to all the SOPs, take your vaccine if possible, and in order to just protect these vulnerable groups, the one that we love and we care most.
That is a very, very painful end to a session, but that is the reality of it. We are at bursting, we are at capacity, and we are taxed to the point of nearly no return. And it is true what Dr. Chin is saying, that we all need to make a concerted effort more than ever to just stay in, stay safe, and be good. Professor Adiba, your final thoughts, please.
You know, I won't be able to top those two messages from Tan Sri and Chin, because they heartfelt and reflecting the true situation, except to say, you know, of course, it's important for every individual to patuh SOP, etc. But those very same people that Chin has described, you know, there are some people who just, because of their life circumstance, just can't patuh SOP, right? Those who live in, you know, dwellings that, you know, force 6, 8, 10 members of the family together. How do you patuh SOP? You know, those foreign workers who, you know, are squashed into dormitories and all of that. So as much as, yes, every individual needs to take our responsibility in controlling this pandemic, I also think that sometimes maybe we're letting, you know, some sectors of society away free. There also needs to be, you know, some repercussions on those who treat other members of society not as well, whether it's government agencies through overcrowded prisons or overcrowded detention centers or unnecessarily arresting people, or owners of these factories and things that we know that we should have learned from the experience from our neighbor Singapore, that had a huge outbreak from dormitories as well. We unfortunately have not taken enough measures to not repeat that a year later. So I think the public who have been trying their best to patuh SOP are also tired of us nagging at them to patuh SOP. So it's also high time that we make people who should be accountable more accountable.
I read you the line. I hear you reading the lines very, very clearly, Professor Adiba. This has been episode 19.
That's because Tan Sri Jamila said I look awful with no makeup on.
Never diss a woman with no makeup on. All right, ladies.
I would have the same eye bags, right? But concealer, and all of us are not sleeping. So.
Well, maybe you can go ask one particular cosmetics entrepreneur to come and make you up, Prof. How about that?
Sure.
All right. So, ladies, this has been episode 19 of Sense with Science. Please join us next week for our final episode where we discuss living with COVID. Meanwhile, let's remember that kindness is a flower that can bloom in isolation. Look out for each other, Malaysia. I'm Karen Nikila Tan, reminding you to choose kindness every time. Bye. Have a great week ahead. Bye-bye.
Bye.
God bless you, Malaysia.
Bye, everyone.